traumatic brain injury interferes with the way that the brain normally works. When nerve cells in the brain are damaged, they can no longer send information to each other in a normal way. This can result in impairment to one or more areas of the brain, such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual and motor abilities, psychosocial behavior, physical functions, information processing, and speech. TBI applies to open head injuries or penetrative injuries to the brain that could have resulted from assaults, falls, accidents, abuse, or surgery, and closed head injuries where the brain experiences internal pressure and shearing of axons due to assaults, falls, accidents, or abuse. Traumatic brain injuries do not apply to brain injuries that could have been considered hereditary. Other non-traumatic brain injuries include conditions that have worsened over time and complications caused by birth. For example, anorexia, metabolic disorders, strokes, or infections would not be considered traumatic. In order to understand how traumatic brain injuries affects a person, we must take a closer look at which part of that person's brain is being affected. I will be covering the following 6 parts of the brain and examine the symptoms and signs a person may show if they have sustained a TBI. The cerebellum, otherwise known as the little brain, is in charge of coordinating and regulating muscular activity. Even though the cerebellum is relatively protected, it is still prone to traumatic injury. A person who has experienced TBI targeted in the cerebellum will most likely show problems in coordinating balance and posture. They will be seen spreading their feet more widely apart as they walk and will often try to compensate for their imbalance. They may also struggle with controlling their stop and go motions. They will also show difficulty in controlling the pace of their actions. Overall, injury to the cerebellum will result in movements that are slow and uncoordinated. The frontal lobe, otherwise known as the control panel of our personality and our ability to communicate, is in charge of executive functions. The frontal lobe is extremely vulnerable to injury due to its location at the front of the brain and its size. MRI studies have shown that the frontal area is the most common area to experience a traumatic brain injury. A person who has experienced a TBI targeted in the frontal lobe may experience impairments in judgment, attention span, and organizational ability, as well as loss of motivation. They may also become impulsive or aggressive compared to past behaviors. A person who has sustained an injury to the frontal lobe may also have difficulty with particular movements and struggle with language. The occipital lobe is known for being the center of our visual perception system. The occipital lobe is not particularly vulnerable to injury due to its location, but any significant trauma could cause extensive damage to a person's vision. A person who has experienced TBI targeted in the occipital lobe may experience loss of vision in varying degrees. Objects may appear distorted in size or color. A person who has sustained injury to the occipital lobe may even experience hallucinations of illusions that are not present. The parietal lobe involves sensation, perceptions, and sensory input. It is in charge of integrating input to form perceptions and construct a spatial system to help a person navigate throughout the world around them. A person who has experienced TBI in the parietal lobe may experience confusion in direction, especially when it comes to distinguishing between left or right. This is called Gerstmann syndrome. They can experience difficulties in visual attention focus and struggle with hand and eye coordination. A person who has sustained injury to the parietal lobe will have a lack of awareness to certain parts of their body, which can lead to difficulties in self-care and hygiene. The brainstem plays a vital role in basic attention, arousal, and consciousness of a person. All information that travels through our body will pass through the brainstem. A person who has experienced TBI targeted in the brainstem may undergo restlessness and irritability. In severe cases, it may even cause loss of consciousness for a dependent amount of time. They will experience breathing problems, abnormal heart rates, or balance disorders. A sustained injury to the brainstem may also result in insensitivity to pain and other sensations, which could lead to further harm. The temporal lobe is involved in the primary organization of sensory input and is associated with memory skills. Aside from the frontal lobe, the temporal lobe is also most vulnerable to injuries due to its proximity to the skull. A person who has experienced TBI in the temporal lobe may notice an effect in their ability to recall verbal and visual content, which in turn affects their ability to understand spoken word. This can also include an impaired memory, as a person may try to recall verbal material and be unable to remember what it is that they wanted to verbalize. A sustained injury to the temporal lobe could have dramatic effects on a person's behavior too. They may experience persistent speech, paranoia, or aggressive fits of rage. In order to help a student who has been affected by a traumatic brain injury, I would first have to learn about which part of their brain has been injured. From there, I would work on making individualized accommodations for that student. For example, a student who has a TBI targeted in the cerebellum, I would be sure to provide that student with space so that they feel comfortable and won't think that they're creating a scene. Since they may not be in control of their motor skills, I would assess the student verbally rather than have them try to write with a pen. For a student who has a TBI targeted in the frontal lobe, I would work with them to help build up their sequencing strategies. Therefore, that student feels accomplished and would hopefully be given that inspiration to kick the lethargy since they have a goal to work towards. For a student who has TBI targeted in the occipital lobe, I would provide them with notes and study guides in an audio form since they may have difficulty with their vision. If needed, I would also move that student closer towards me so they could hear me more clearly without distractions. For a student who has a TBI targeted in the parietal lobe, I would set up our classroom to work in pairs or groups. During this time, the student with the TBI would be able to work with others who could keep him focused. The group work would consist of taking ideas apart and reconstructing new formed group ideas that will help that student form new strategies to help establish a sense of order. For a student who has a TBI targeted in the brainstem, I would be sure to allow enough time for them to finish their work and exams so they don't need to feel pressured by a specific time frame. During the day, if that student requires to take breaks to regain their composure, I would make sure they had a safe place to do so, such as the nurse's office. For a student who has a TBI targeted in the temporal lobe, I would work closely with and provide positive reinforcement and feedback about the work they are attempting to do. Since they may struggle with memory and learning new concepts, I'd focus on the quality of the work the student is working on, rather than quantity of how much they're able to do.